All right, today we're tackling a big one, the prescription asthma medication Zafirlukast. We're going to get into what it is, how it works, and maybe most importantly, clear up some big misunderstandings about its role in managing asthma.
Okay, so let's jump right in with a super important scenario. Picture this. You're wheezing, you can't catch your breath, you're having a full-blown asthma attack. Now, if the first thing that pops into your head is, I need my Zafirlukast, well, that's a really dangerous mistake, and it's exactly what we need to talk about right now.
And here it is, the single most important thing you need to remember. Zafirlukast is a controller. It's for the long game, for preventing attacks down the road. It is absolutely not a rescuer. It can't stop an attack that's already happening.
So you can really see the two different jobs here, right? A controller, like Zafirlukast, that's your bodyguard. It's working in the background, day in and day out, slowly and steadily, keeping things calm. Your rescue inhaler, that's the firefighter. It's for emergencies only. Fast-acting, powerful, and you use it when you need it right now. You can't swap one for the other. Period.
Yeah, so its whole mission, its entire purpose, is to keep your asthma in check day to day. What's the end game? Fewer symptoms, less severe symptoms, and ideally to get you to a point where you barely even have to think about reaching for that rescue inhaler.
Okay, so how does it actually do that? How does it prevent an attack from happening in the first place? Let's get into the science a little bit, but don't worry, we'll keep it simple. It all comes down to these little alarm signals inside your body.
See, when you breathe in an asthma trigger, like pollen or dust, your body releases these things called leukotrienes. And you can just think of them as these tiny, microscopic alarm bells. They go off and start shouting, code red, inflame the airways. And that signal is what tells your airways to swell up, get tight, and produce all that gunk.
So here's how Zafirlukast plays defense. Those leukotriene alarm signals, they're trying to race over and flip the ignition switch, that's the receptor, on your airway cells. That switch is what starts the whole inflammation process. But Zafirlukast is clever. It gets there first and puts a little safety cover right over the ignition switch. So when the alarm signals show up, they can't flip the switch. The engine of inflammation just never even starts.
And the result of blocking that signal is pretty awesome. Your airways can actually relax and stay open. The swelling goes down, there's way less inflammation and less mucus. It's all about stopping the cascade before it can even begin.
Okay, so we know how it works in theory, but now for the really practical stuff. Because this drug is so specific in what it does, you have to be just as specific in how you take it. There are some rules, and they are absolutely crucial. First up, the dosing. It's pretty straightforward, actually. For adults and kids 12 and over, it's usually 20 milligrams, twice a day. For younger kids, ages 5 to 11, it's a smaller dose, 10 milligrams, also twice a day.
But here comes the big one, the most important rule of all. You have to take it on an empty stomach. And that's not a fuzzy guideline. It means you take it at least 1 hour before you eat, or you wait a full 2 hours after you eat. This is non-negotiable if you want the medicine to do its job.
So why this strict rule? Well, it's all about absorption. If you have food in your stomach when you take it, your body just won't absorb the medication properly. In fact, food can cut the absorption by a huge amount, making the dose way less effective. You'd basically be taking the pill for nothing. All right, let's shift gears and talk about risks, because every medication has them. With Zafirlukast, a lot of the common side effects are pretty mild stuff. You know, headache, maybe some nausea or diarrhea. But it's really important to know there are some more serious, though thankfully rare, things to look out for.
So this is a team effort with your doctor. You both need to be watching for any signs of liver trouble, things like yellowing skin or eyes, or serious fatigue. And also keep an eye out for any big changes in mood or behavior. But beyond that, there is one particular drug interaction that we have to talk about. It's a big one.
Okay, listen up, because this is a huge warning. If you are on the blood thinner warfarin, taking Zafirlukast at the same time is a really big deal. Zafirlukast can basically supercharge the effect of warfarin, which puts you at a much higher risk for dangerous bleeding. This combination requires incredibly careful monitoring by a doctor.
So, okay, with all these strict rules and some serious risks to think about, you might be wondering, where does Zafirlukast even fit in today? Is it still a common choice?
Well, for most people with persistent asthma, the #1 first-choice treatment is usually an inhaled corticosteroid. Think of it like a broad-spectrum anti-inflammatory.
Zafirlukast is more of a specialist. It targets that very specific leukotriene pathway, so it's often used as an alternative if someone can't take steroids, or as an add-on therapy if the steroids aren't quite enough on their own.
And that brings us to its direct competitor, a drug in the exact same class called montelukast. When you put them side by side, the differences, especially in convenience, just jump right out at you. It really comes down to this. Zafirlukast is twice a day, and you have that strict empty stomach rule. Montelukast, it's once a day, and you can take it whenever, with or without food. And you know what? That simple difference is a massive deal in the real world. That easy, once-a-day, no-food rule schedule has made montelukast way more common. It's just easier for people to stick with. Okay, let's wrap this up. What are the big takeaways? First, Zafirlukast is a controller, not a rescuer. It's for prevention. Second, that empty stomach rule is everything. Take it 1 hour before or 2 hours after food, no exceptions. Third, you've got to watch for those rare but serious risks to the liver and your mood. And fourth, that warfarin interaction is a major red flag. All this means it's just not as common a choice as it used to be, mostly because of how strict the rules are.
So that kind of leaves us with the final question, right? Given all the strict rules and the other options out there, is this controller the right fit for your asthma plan? At the end of the day, the best medicine is the one that actually fits into your life and keeps you safe. And that, of course, is a conversation you got to have with your doctor. Thanks for tuning in.